Hello, and welcome to the GRACE podcast series. My name is Denise Brock, and I am the Operations Director for the Global Resource for Advancing Cancer Education, or GRACE. In this podcast series, we interview patients, advocates, and healthcare professionals to provide the most updated information for our community and to highlight important issues facing those dealing with a cancer diagnosis. We hope you find this information valuable. For questions or comments, please visit us at cancergrace.org.
So the FLAURA trial is a randomized, double-blind phase 3 trial in patients with untreated advanced EGFR mutant non-small cell lung cancer. In this trial, patients with exon 19 deletion and L858R mutations were included and were randomized either to osimertinib or first-generation EGFR TKI such as gefitinib or erlotinib. And the FLAURA trial showed that osimertinib improves progression-free survival, with the median PFS 18.9 months with osimertinib versus 10.2 months with first-generation EGFR TKI therapy. The hazard ratio of 0.46, suggesting there was 54% reduction in the rate of disease progression or death if the patient received osimertinib versus first-generation EGFR TKI therapy. Later, the trial showed improvement in overall survival, with the median overall survival with osimertinib being 38.6 months versus 31.8 months with the first-generation EGFR TKI therapy. And the hazard ratio was 0.8, suggesting 20% reduction in mortality if the patient received osimertinib. One of the differentiating features of osimertinib with earlier generation EGFR TKI drugs is osimertinib has pretty significant central nervous system activity. It can go to the brain pretty well. In this study from the FLAURA trial, there were patients who were evaluated for the brain tumor shrinkage rate called CNS objective response rate. Although the subset of patients was small, and then some patients received prior brain radiotherapy, the rate of tumor shrinkage was 91% in this particular subset of patients, which is impressive. Looking at the side effect profiles of osimertinib versus first-generation EGFR TKI therapy in the FLAURA trial, the rate of grade 3 and 4, so severe adverse events, was lower with osimertinib versus first-generation EGFR TKI therapy. Patients who received osimertinib were less likely to develop rash, as well as elevation in the liver enzymes. However, there are certain things to monitor when the patient is on osimertinib, such as a change in EKG called prolongation QT interval. And so certain patients with risk factors, it is reasonable to monitor their EKG on a regular basis. Also, rare side effects of osimertinib include interstitial lung disease. We call this also pneumonitis, and then a drop in the heart function called cardiomyopathy. These are rare. The instance of the interstitial lung disease is 3.3% versus 1.4% for the cardiomyopathy. While osimertinib is an effective therapy, patients can develop resistance to osimertinib through diverse mechanisms of resistance. And this study is from a FLAURA trial utilizing circulating tumor DNA testing. And it showed that patients can develop resistance through a wide array of mechanisms, including secondary EGFR mutations, such as C797S, and also activation of other signaling pathways through amplification or fusion events. Also, it is important to remember that some patients can have resistance through histologic transformation, such as transformation from non-small cell lung cancer to small cell lung cancer. So it is therefore reasonable to consider tumor biopsy at the time of progression on osimertinib. And this is one of the studies I was involved, showing that mechanisms of resistance to osimertinib can sometimes be diverse and often multiple. And so more research is needed to mitigate the risk of development of multiple resistance mechanisms, and also find ways to overcome those resistance mechanisms.
Thank you again for joining us. This podcast was made possible by the generosity of sponsorship from our friends at Lilly and Exelixis. Please like and follow us on Facebook and Twitter. Send us feedback, share your story, donate, and visit us for more information at cancergrace.org. Thank you for listening.